Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 660,289 confirmed cases of COVID-19 in Canada and 215,782 cases in Ontario. Chatham-Kent has 844 cases and Sarnia-Lambton has reported 1,224 cases. Michigan now has 519,082 cases with 26,760 cases in Detroit. Today we are reporting 142 new cases of COVID-19 in Windsor and Essex County. 11 cases are related to outbreaks, 3 are close contacts of confirmed cases, 2 are community acquired, and 126 cases are still being investigated. We have had 9,815 cases since March. 6,877 cases are now resolved, and 2,728 people are active at this time. 99 confirmed cases are currently in the hospital and 17 people are in ICU. Our community has now lost 210 people to COVID. 139 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 45 active outbreaks in Windsor and Essex County. 21 are in long-term care and retirement homes, 19 in workplaces, 3 are community outbreaks, and 2 outbreaks are in the hospital. Vaccination of residents, staff, and essential caregivers of our long-term care homes continued this past weekend, and we're happy to report that we have reached all 19 long-term care homes with first doses. We will be circling back with all homes to ensure any outstanding residents, staff, and essential caregivers are provided with their first dose. So a huge shout out to the long-term care homes, their supporting hospital partners, but especially to our incredible nurses who have done an amazing job these past 10 days. As a pilot site for the first doses of Moderna, our health unit staff at every level contributed to this successful rollout. So we're very happy about that. We are starting vaccination in 2 retirement homes today. We also completed 2 previously because they were joined with long-term care homes. So we're on good track there as well. We continue to work closely with both long-term care homes and retirement homes to get everyone vaccinated. Despite the rollout of the vaccine, please continue to follow public health measures. Stay home if you're sick, limit your close contacts to your household members only, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering and cover your mouth and nose with a tissue, or use the inside of your elbow when you cough or sneeze, and download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. I don't have much to add today other than just to echo what Teresa said. Our region has been one of the hardest hit region in the province when it comes to COVID cases, and we're really happy to report that we are able to complete the vaccination, first round vaccination of all the long-term care homes in our region, and we are the first health unit to complete all that in the province. So that's another on top of our incredible amount of caseloads that our staff has seen. Our long-term care home have seen the worst of the outbreaks, and they have really come through. They really worked with us to get all of this done, and ahead of the schedule. I know the province wanted us to vaccinate all of these homes by January 25th, and today is January 11th, and we completed everything yesterday, so that was January 10th. Within that short period of time, an incredible amount of work that has been done, and I think this is something that that should be acknowledged from the health system partners, everyone who come together to do that. And finally, the message around the safety and the timeline that it would take for the body to get that immunity built up it takes time. It will take at least 10 to 14 days or 2 weeks to be safe for any type of immunity that we can see on the people who are getting the vaccine at this time. We know from the clinical trial data that the vaccine would be more effective when people have received their 2 doses. So now is not the time for people who have already received their vaccine to think that they now are safe. We still have to follow all the measures that we have been talking about in public health. We really hope that over some time period, all of these vaccines that have gone into the arms of the people are showing its results and its impact, but we have to be patient. We have to continue to follow everything that we are doing right now. So I just want to make sure that people understand that, especially those who are getting the vaccine, that it takes time. So just hang in there, continue to follow all of those measures until people get their second dose, then we will be in a much better position. Thank you.
We'll now take questions from the media. Today we'll start with AM 800.
Teresa, you mentioned off the bat how of an accomplishment this is a goal of the health units. I guess when you announced that the vaccine was in Windsor, come to the health unit, excuse me, and you talked about the rollout process, just to have it done in 10, 11 days, did you think that was realistic, or this just seems like a remarkable accomplishment?
So I think I talked about it before, and totally do not want to take the credit for any of this. There's so many people involved to make this happen at our health unit site and also all the long-term care homes. But the schedule was, like, we did create a schedule, and the long-term care homes, we worked very closely with them to adhere to the schedule and really support them in getting this rolled out. And probably the biggest challenge would be the reporting of the vaccination in live time, which is this COVAX system. So yeah, it is a huge accomplishment. There's a lot more work to do, though. I know the amount of vaccine that we have. We want to include essential caregivers because they're going into the homes. The staff have been getting the Pfizer vaccine, but also they can get the Moderna when we're in the homes. But there are still some outstanding people because many of our homes have been in outbreak. And so not everyone was able to get the vaccine when we were there. So even though we're completed, we've done first doses and we have immunized a lot of people, there are still outstanding people based on the fact that they have to recover before they can get vaccinated. And so we're working with the homes. We continue to work with them and support them, but it is a huge accomplishment, and it's a great start for our community and for those that have been impacted by COVID so much these past 10 months.
With the individuals that are still outstanding and the ones that might have rejected it, do you have an estimation on how many individuals that is? Is it hundreds, thousands? Do you have an estimation?
Not thousands, but I didn't really look at all of that because as we reconcile the staff, a lot of staff got their vaccinations done at through the Pfizer clinics at the Sportsplex, and so the staffing, I'm not sure. The essential care givers, it depends how many are per home, and typically some people have essential caregivers, some do not. They're registered with the home, and so that varies. So that number isn't. I don't know all of that number, but we are offering it to everyone, communicating that any essential caregiver, any outstanding staff that haven't received it yet should be getting it. The residents, of course, good uptake with the residents. And when we circle back, it will be those residents as well that were in outbreak and were recovering from COVID and weren't able to get the vaccine at that time. So when they get better, the homes will be able to give them their first dose. And then we'll go into the second doses. So the Moderna vaccine, you can start your second doses. It's 28 days later. And that'll come up before we know it. So we'll be back doing second doses and supporting the homes. We're hoping the majority of homes will be able to move on themselves with us just delivering the vaccine. But we want to support them to get this done. As Dr. Ahmed said, it's those 2 doses, and then we can, breathe a little easier 2 weeks after the second dose.
And finally, maybe a 2-part question here. Do we have enough vaccine to get through the rest of the retirement homes in Windsor-Essex, or are you expecting another shipment shortly?
We're hoping for another shipment. We're really monitoring our inventory. Right now, we're reconciling it. So I would say we need more vaccine to move forward to get this job done.
Thank you.
Any questions from CTV?
Yes, good morning. Just wondering if you happen to have a timeline as far as the retirement homes when you hope to have them vaccinated, assuming that you do get the other shipment of vaccine.
I did have that date, and I have it slipped from my mind, but I know the province would like everything done by the 25th of January, and we'll accomplish that. But I'll have to look because they're also scheduled, and we do have, today we're doing 2, but overall we have, after today, we'll have 20 retirement homes. So, we'll see, because some of the retirement homes are actually going to be doing their own vaccination, and that is just a vaccine delivery. So when they're ready, we just deliver that. So maybe I'll look at the schedule and try to answer that tomorrow, because I know that they're all scheduled as well.
Okay, great, thank you. Now, Dr. Ahmed, with the case counts just starting to decline today and no additional deaths, are you hopeful that we could be turning the corner with getting things under control as far as the spread?
I don't want to jump too quickly on to conclusion that we are actually seeing a decline. I truly hope so, but this is just a 1-day decline, and we'll have to see what the next few days bring. I would be really happy if we continue to see that downward trajectory, and that would be the good news for our community, that the vaccines are rolling out, the case counts are going down. This will be an overall very good news for our community, but I think it would be too early to say that just a single day decline in the number of cases is something that we can all be happy about.
Okay, thank you.
Any questions from Blackburn?
No, thanks. We've all been answered. Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. You may have said this previously, but is the health unit saving or holding back the second dose, or is it doing what the hospital has done under the province's direction, which is immunizing as many people as possible with the first dose in hopes that a second shipment or further shipments of vaccine arrive?
So I'll start the answer, Taylor, and then Teresa would add in. I think the province direction at this time is to make sure that all the long-term care home, retirement home, residents, healthcare workers, caregivers, they need to be vaccinated. That's the direction. That's very clear. And then obviously there are other considerations when it comes to the healthcare workers that's been there. So I think we really have to be very prudent in how we are reaching out to these people who are identified as the priority from the province, and as well as based on the number of different prioritizations set out by the National Advisory Committee on Immunization, the province, and the various ethical consideration that goes into the vaccination. It's not just about giving out the vaccines to as many people as possible. I think we also have to be very careful in ensuring that the right people are getting the vaccine at the right time.
And so we are, at this time, we are monitoring the inventory and trying to make sure that we have enough for the second doses, as we'll be starting those, as well. So right now, we're you know, we're getting close to the limit, but we are expecting another shipment. So hopefully it all works out, but we're, you know, really tracking every dose.
Okay, thank you.
Any further questions from AM 800?
Just one for Dr. Ahmed, and I have a message out to Windsor Police as well. But yesterday there was another rally at the riverfront. Dr. Ahmed, I know this is probably more of a Windsor Police question, but are you disappointed that it wasn't broken up right away?
Well, all I can say at this time, Rob, is we are in a lockdown, and we are not even a lockdown just in the region, but there's a provincial lockdown order that's been issued, which clearly prohibits any of these type of gathering. And I hope that people get that message loud and clear. I don't know how is that difficult for anyone to understand what the message is and what the requirement is. I'll just say to that it's not allowed, and it's not okay to have these type of gatherings.
Thank you. Have a good day.
Any further questions from CTV?
No, thank you.
Blackburn?
No, thank you.
Windsor Star?
No, thank you.
Thank you, everyone. Have a good day.